Unit Achievement, Public Health, Meritus Health. At the start of 2020, Meritus Health began planning its strategic Bold Goals initiatives, its annual nursing recognition, and fundraising events, and its continuing efforts to improve quality healthcare in our region. Then, COVID-19 came to the U.S. As the regional trauma center and largest healthcare provider in the area, Meritus Health is always preparing for emergency situations. However, a novel coronavirus that could spread through the air was a fairly new experience for most of the staff and leadership. It became obvious early on in the crisis that many things would need to change before the virus ever came anywhere near Washington County. With only a few months on the job, new President and CEO MAULIK JOSHI led the organization head-on into emergency planning and preparations. With the leadership and support of an incident command center team that included managers and employees from across Meritus Health, resources were pulled together to meet both immediate and future COVID-19 needs. Where daily hospital duties continued, leadership knew that Meritus could also support the county, the local health department, first responders, and community members in a variety of ways. As elective services and surgeries were suspended to help control community spread of the virus, employees from those areas of the health system stepped into emergent roles and learned new skills. These included coordinating virtual visits between patients and family members who couldn't come into the hospital, stocking hand sanitizer, gloves, and other important items on the units, testing community members at the drive-through COVID-19 screening center established at Meritus Medical Plaza, and answering calls on a 24-hour-a-day hotline when community members had questions about the virus. As soon as the U.S. Food and Drug Administration authorized emergency use of the first COVID-19 vaccine in December, the Meritus Health team was ready to provide shots to the community. After health system providers and staff who were part of the state's 1A vaccination phase received their vaccines, a vaccine clinic for Washington County residents age 65 and older, phases 1B and 1C, was soon opened. While vaccine allocations from the state varied from week to week, Meritus Health administered all of the product received, avoiding clinical waste. They provided more than 50,000 shots as of mid-April 2021. Meritus Health has been able to maintain its own clinic on campus while stepping in as a clinical partner for the state of Maryland's mass vaccination site at the Hagerstown Premium Outlets and setting up pop-up clinics in rural areas of the county, including Hancock and Cascade. Apparent right at the start of the COVID-19 crisis was the immediate and unending support of partners. Volunteers offered their time to create protective face shields, sew masks and gowns, deliver care packages, and even join neighbors and friends to drive by and honk or park and pray in support of all of the work being done at Meritus Health. Leaders and staff have been working with the county's Emergency Operations Center team to communicate data and ongoing preparations for COVID-19 needs since the beginning of the pandemic. As this coronavirus continues to bring people to our hospital for treatment and sadly claim the lives of neighbors, friends, and family members, Meritus Health remains vigilant. The Meritus COVID-19 Drive-Thru Screening Center remains open for community members to be tested for the virus. Meritus Medical Laboratory processes hundreds of these tests daily to get results back to patients quickly and accurately. Meritus Regional Infusion Center continues to provide cutting-edge therapy with monoclonal antibody infusion targeted to prevent worsening of the disease. As vaccine allocations are received, redeployed Meritus Health employees, including many school health nurses who didn't have open public schools to report to, will continue to vaccinate the community against COVID-19. As more businesses reopen and more people start to find their new normal, our Meritus Healthcare heroes, those treating patients in outpatient practices, clinics, and centers, through telehealth visits and in the hospital, are still here. Some serve as the only family able to be with those who are very ill and away from their own families. All continue to show up and care and are here for the community when it needs them most.